Morning, and welcome to another installment in the Formfast Educational Webinar Series. I'm Aaron Vaught, Director of Marketing here at Formfast. Thank you for the time to join us today. In our session, we heard from Scott Fuller, author, thought leader, and Director of Solution Architecture here at Formfast. He shared a vision for healthcare organizations entitled The High Performance Hospital. As always, recording previous webinars, including that one, is available on our website at formfast.com/webcast. In a few months, we've shed some light on the need for greater efficiency and data utilization in the hospitals. Understanding and executing tasks more effectively is necessary to improve the hospital's bottom line while boosting quality. To talk about some of the specific ways the hospitals are using workflow technology to do just that. But before we start, let's review the interface. The audio from today's event will be broadcast through your computer speakers. If you're having trouble hearing the audio right now, contact me via the chat window on the right side of your screen. Questions at any time, presentation in the Q&A section or the chat will be reserved to the end of the session in that portion of the presentation. Those of you who are new to Formfast, we want to take a brief second and tell you a little bit about ourselves. We provide automation solutions for healthcare, including electronic forms management or eForms, work automation, business intelligence or process improvement tools, document storage features, and output management. What you can do in your hospital is summed up in this word: simplify. For those challenging tasks that you are struggling to manage, whether in audit management or case management, HR, patient finance, challenging tasks, we can help you simplify those through our workflow automation solutions. If you're a hospital leader looking for ways to get better information about issues with patient safety or with revenue loss might lie, we can help you simplify the process of determining where those issues are and make better decisions. To segue into today's presentation, Jordan Miller and Pat Murphy, both workflow specialists with Formfast. Jordan and Pat have both had a long tenure in healthcare IT, previously working for Perceptive Software. Formfast, they collaborate with hospital staff to identify needs and needs for automation in the organization. They'll be sharing some of the ways that workflow technologies have been used to enhance the existing systems that you've invested in. So Pat, I'll turn it over to you at this point.
All right.
And you're free to either share your desktop or use the slides up at the top.
The slide?
That looks great.
Hope so. You're excellent. Well, happy 10, 11, 12, everybody. Exciting today, talking a little bit about Gap workflow. I'm Jordan, I'm a regional sales manager for Midwest, and I'm joined with Pat Murphy.
Thanks, Joe. So today I have a whole discussion about workflow in healthcare, but go a bit deeper on a specific concept of Gap workflow, which is where Formfast and our company spends a lot of time helping hospitals identify areas within their organization that have not been fully addressed or have been missed with some of the primary applications they use. So we're going to kind of help you understand the case for adopting a Gap workflow solution across your different processes, and hopefully any questions you guys have, we can provide answers to. So from this standpoint, we want to talk about a number of concepts. So we'll spend a little bit of time about the high IT landscape, what it looks like, what are some of the trends within healthcare around that. Building the case for workflow or Gap workflow in your hospital and where it can add value. Some of the challenges and barriers you might run run into as a part of that effort, and then how the gap workflow approach can address those issues. And talk about some specific examples of where you could apply gap workflow in your organization. Again, if we have any questions at the end, we'll be happy to take those. For those of you who are familiar with our company, you may be familiar with this slide, but it essentially addresses some of the challenges that hospitals face today. So at the top, we have the concept of the paper chase. The goal of hospitals to minimize paper in their process because of the that it presents, the minimal efforts, the ability to track that paper. It's not a strategy moving forward for today's hospital. The information that your organization needs in order to provide better patient care and to make better business decisions resides in multiple places, and the ability to aggregate that data and bring it together in a meaningful way. And hospitals with the concept of having to do more with less. Regulations come into play. Costs increase, reimbursement gets lower. Every hospital has this challenge, and we feel our technology has a play in that. Finally, the in processes or in your workflows. The multiple teams and applications that your hospital runs, and finding a solution that will address each of those different areas for each of those different departments.
Presentation today is going to focus quite a bit on the whole idea of and concept of gaps in workflow. The things that we need to do, before we get into that and how we can address that, is to talk a little bit about why those gaps exist. And we just take a step back and we look at, our typical healthcare organization. Commonly Pat and I find that they come in, one or two different varieties. They're either an organization that's working with a single platform, such as a Medtech or a McKesson Paragon, that's using a lot of integrated applications, provide a single vendor in order to automate and manage health information data as well as informational data about their organization. There's some benefits to that single platform in the sense that you've got one vendor that you're working with, you've got one platform, so a lot of data can be shared a little bit. It's typically lower cost than other alternatives. But again, it provides you a lot of bang for your buck in a lot of those core applications. And also that, might be a best of breed approach. This is an organization that, has Epic or Cerner for their EMR, that's using Lawson or Oracle for their financials, their materials management. They're using maybe PeopleSoft or Kronos for employee data management or time and expense or, employee scheduling. Some of the benefits of this type of IT system, is that it provides a lot of tailored functionality. How it can come at a cost. It can be expensive to go out and acquire all these individual solutions. It can be expensive to manage all of these different things. There are some integration challenges because each one of these systems might be, it's completely separate silo. Data for your HR may not fall over into data for accounts payable in your clinical system. And so as you're trying to tie all these different systems together, you're going to face certain integration challenges. And that is ultimately going to spill over into time and expense associated with supporting and training overhead for all those different applications.
And what we've all come to learn in healthcare, obviously, is that if you look at either of these models holistically, you would come to the conclusion that it addresses all the needs of the organization. But as hospitals go to apply that technology in the day-to-day care of their patients or the responsibilities of the hospital, they find areas where it's lacking, maybe something that wasn't thought through, or new process regulations come into play that require additional automation that's not providing that. And I feel the gap workflow can address either of these models to bridge the gap or to get that hospital kind of to that last mile concept of automation. Talk a bit about like some of the goals for workflow. What are hospitals striving towards when they implement this kind of technology? So the big one is to enhance applications across the department. So again, some of those gaps fall into play where paper presents itself as the only option to document certain an opportunity to fill that void. The opportunity to improve visibility to the information you're collecting as you gather that information is important through reporting. To gain efficiency both within the department and across multiple departments, implement that process. Improving the accountability for those all, normalize and standardize the processes of the organization. So to really take and understand what are we trying to accomplish here and how do we enforce those policies that we've defined. And one of the more obvious ones is eliminate the slow, manual, paper-driven process that we find within the organization.
So, as we reviewed the goals, those are big reasons why organizations implement either that single vendor approach and deploy that IT ecosystem or that best-of-breed approach. But oftentimes there are challenges and barriers to allow us to get there. So many of these solutions, some of those challenges and barriers are the fact that many of these solutions are process or department specific. So, we might be able to automate 80% of the functionality, but oftentimes there's this additional piece that doesn't quite make it in. Workflow automation can also be an iterative process. What we mean by that is the idea that we're going to constantly be focusing on the saw and reinventing the wheel, and our processes are going to change, and so that can be a challenge and a barrier if systems that we're working with aren't flexible enough to flex and change with us. Choosing the right platform, what we mean by this is there are often many different tools out in an IT ecosystem that kind of offer similar or the functionality. So figuring out and identifying what solution is going to have the least path of resistance and provide the greatest bang for the buck or bang for our time is very important. Lack of integration can be a huge issue. We see this a lot more in organizations that will choose the best-of-breed approach. It's so much more present, those data silos that Pat was talking about earlier, that can cause an issue where employee data may not be with other data that we may need to manage our processes. Healthcare-specific focus. This is more common in that best-of-breed approach where you might be going to pick up niche solutions to address specific needs. You may be working with vendors who don't understand healthcare, who haven't been fully exposed to a healthcare environment, so they don't know the unique sets of challenges that hospitals and healthcare organizations face. Again, the whole idea that these solutions oftentimes fail to address the entire process. Even with, the best technology, time and time again, Pat and I go out and have conversations with folks where it's automating 80% of their process. But at the beginning of the process or at the end of the process, there may be a piece of paper that's still there for you to fill out and get right around for approval before someone in maybe materials management or purchasing enters a transaction into Lawson or a transaction into Paragon. So, those are the challenges and barriers why we don't achieve that type of workflow automation that we're wanting.
So in understanding those challenges, we shift to understand what is the approach with gap workflow, what attributes of that approach that are going to allow today's healthcare organization to more easily overcome those challenges. So it has to be a system that does not require a huge threshold to install and configure. So it has to be easy to deploy. It has to be a quick win for the organization in order for them to realize the benefits of it. Provide integration options to multiple applications to aggregate that data and bring it together. It's useful to end users and administrators. It has to be somewhat familiar for the end users. They have to, again, you can't adopt technology that has a huge training curve to it that's going to slow option or make the solution unusable. It has to be a solution that's scalable. So both terms of adding users to that solution, but also as the organization finds opportunities to leverage that platform into other processes or departments. The organization spoke to earlier, it has to be flexible. So as we implement technology, we often find that go live is a little bit different than what we were originally intending during the planning phase. So it has to be really flexible to adapt to that. Both happens, but also as outside forces, require changes to the process. Also need visibility. All this data that we're collecting electronically, we have to be able to use that and leverage that to improve the process. So it's very important. So every solution should have the ability to report or at least export that data to some type of reporting platform where you can leverage the data. And finally, it has to be enterprise approach. There's lots of solutions out there that address specific problems. Healthcare and specifically hospitals don't have the opportunity to go out and adopt or buy all those different solutions. They need one solution that's going to be able to address a majority of their issues.
Yeah, really, just to add to that, something that can complement an existing infrastructure. So where your organization has chosen a best-of-breed approach, or whether you've chosen kind of a single vendor or single platform type approach, a gap workflow solution is one that can help align the systems, processes, and people, really focus on identifying opportunities to fill any chinks that may exist in that armor, and kind of close the loop on apps that exist in those other systems.
One of the things that we talk about is the enterprise workflow, and this is kind of preface to what we're talking about with that gap workflow solution. It has to be a platform that I can plug into, maybe opportunistically as I find them or as I come on those gaps, any department within the hospital, whether that's clinical in nature or more administrative back office type functions. So we want to help understand the application of gap workflow in the hospital. We thought we'd go through some different opportunities across the hospital and how you can apply these and use these, to better those processes.
And as I look through these, some of the things that we're going to see time and time again are that this process or an opportunity that we might be talking about is specifically going to be discussing a solution where another piece is in place to make a lot of that particular process. A gap workflow is just complementing that. And so like here, when we talk about physician coding query, we're going to see how, for example, an organization that might be using McKesson's HPF product have, the chart review, and a coder may be looking at doing some abstracting, and they hey, we've got a diagnosis code on here that we're not really sure about, so we can leverage some integration with HPF or any other application to call and launch FastFlow and pass in some of that patient context as well as some of the coding context and application context to print a lot of that form. So, traditionally this may have been a paper process. This may have been a note in the chart. This may be an area where a physician wasn't able to, where a physician could complete all their other deficiencies electronically online. A coding query may have been something they had to physically come into the office or through an unstructured process like email. Now what we can do is we can make it more complete and more seamless, where a coder can have that information pre-filled, they can enter in their question, and that information can be sent to a physician through a structured means, potentially even integrating with the way that their other deficiencies get handled. Here we're doing integration with HPF's webstation, which is a physician portal product, where you see all of your deficiencies, and here you see the coding query deficiency is a new type that may not exist. When a physician clicks into that, they see a question from the coder, they can quickly and easily respond to it, and they're going to hit submit. It's going to seamlessly be pushed back to the coder, and the end result is going to get stored in PDF or whatever your legal health record for your scanned images is.
Area where we see struggling is, comes to external audits on their facilities. So specifically, we're talking about a RAC audit. Fairly, depending upon the organization's policy and how they intend to do those audits, can be fairly sophisticated. So, be it a gap workflow solution, and some hospitals' core HIS system may have some functionality to respond to a RAC audit, but often they'll find that there's limiting factors to those solutions or applications that prevent them from really using it in a way that's going to allow them to respond the most effectively. So, FastFlow, the Formfast product, we can work either in conjunction with that application to fill that void, or we can be a standalone solution to address that workflow solution. To receive that claim complete to the specifications of the facility, route, notify the individuals who would be involved in that workflow, and allow that process happen, 100% electronically. Either store that information within Form or archive back to the HIS system or that request. So obviously compliance is a huge opportunity for hospitals to manage their risk. And one of those areas that we've seen a lot of interest from organizations is around incident reporting or document any information that you have to document related to compliance in the hospital. There's an accident, someone falls, the organization has to document that. They have to notify people within the organization as to what's transpired. In addition, they have to continually track that information so they can see how the organization is trending and how can they make improvements to do that. So not only building the application to document and track that information, but all the reporting that goes along with it. So the ability to aggregate that data, see it visually, to help the person in the organization understand, where are we having issues across our different facilities, and actions can we take in the future to avoid that.
Reporting and analytics framework really give organizations the power they need to take unstructured processes, build some structure to it, but provide discrete data which we can report upon, and we can really drive and impact change. It can give hospital and healthcare decision makers the information that they need to choose where to focus resources and to choose what they need to do in order to positively move their organizations forward.
So that we've seen a lot of traction is in financial services, and a lot of processes that happen within that department that are dependent on really strong communication both within that department but with other departments as well. So there's gaps that can be addressed with a gap workflow type solution. So in the case where we have a claim that's rejected, there's an opportunity there to recover revenue if we can document that information in the best way. So one of those approaches is to build an application in Formfast that allows you to document information that you need to collect from departments within the hospital, so you can intelligently respond to that claim and make your case for why that should not be rejected. So really what you're looking at right now is just the attributes of the form. We can control the look and feel of this form, the fields that you need, and then control what happens to this form once it's created. And we do that through our workflow administrator, the ability to workflow steps or routes that, once we receive this claim, where does it go to? Who needs to review it next? What additional information needs to be applied to this form as it gets routed through the process?
And the workflow administration tool is the that you would be empowered to use, make modifications and changes after the fact, so that if we need to modify one of these steps or a series of steps to add add some additional decision making or another chance for review or signature, we would be able to come in here and easily optimize this process. So as the process continues to evolve, it's going to be easy to make those changes in the enterprise platform.
So the reporting and the importance of, giving some visibility to what's happening. What type of claims are we getting, and what can we make further upstream within our process to, get them lower or to have fewer of those over time. And reporting becomes a very critical part of the solution in making improvements over time.
Yeah, just to echo that. I mean, especially with these types of opportunities where revenue can be, directly impacted with coding query, with billing routine workflow, with audits. Having visibility and having that information and knowing the amount of time you have to respond and knowing the amount of revenue that's at stake really allows an organization to prioritize and maximize its impact and really allows them to do more with less. So it's so important that you have all of the information quickly and easily at your fingertips so that not only can you more effectively respond to all the requests, but if there ever comes a time that you have more than your organization can deal with, you want to be able to prioritize and reprioritize quickly. So having that data is just so crucial to be able to make those decisions.
So another department that we found tends to have a lot of gaps is human resources or personnel. And it's a feature of how specialized those processes are. You'd argue that HR has many departments inside of it. It's role, it's evaluations, it's benefits, credentialing. There's just lots and lots of processes within HR. There's very few applications out there today that successfully provide a solution across all those different processes. So this is a huge opportunity for Gap workflow, and one of that is staff evaluation. I have a solution with core HR application, but maybe it doesn't meet all of your needs, or maybe based on your process, there's areas that it just handles. So this is an area where we can step in with your solution that would functionality in conjunction with your primary HR system to address all the needs of the process. So it can be designed however you need them to look. The administrative console would allow you to define, once we collect the staff evaluation form, where to go next. Does it go to the manager? Does it go to the director of that department? Does this finally get archived back to HR for storage and retrieval at a later time? One example within HR, there's multiple processes where maybe there's something missing that you need small to step in and fill that gap. Another great example for gap workflow is in your financials. So there's if you take Meditech for an example, there's certainly a way in Meditech to generate purchase requests, but not a great way for all the stakeholders within an organization to approve or review that purchase request before it's finalized in the system. That's where Formfast can step in with a purchase request solution that allows you to integrate with the Meditech platform, form, and then route the individuals across the organization who need to review and approve that form. Additionally, the Gap workflow solution, we can build rules and logic into that application to make sure that your policies are in place for how purchase requisitions should be approved.
Screen is just showing kind of the interface, and one of the things that I wanted to just here is when we think about rolling this out organization-wide, when we think about bringing up a solution so that every manager from every department, whoever needs to file a purchase requisition or a capital expense request or a PR, approval form or something like that, when you think about the training that might be involved, taking that to a very niche solution or some kind of other system, this looks and feels like what they're familiar with. And one of the best ways to ensure success and to ensure adoption by end users is to take a new process, moving this online to a more efficient process, but wrap it in old clothes, make it look and feel like what's familiar. So we're able to do that with FastFlow because we can take that form, and we can use the same form designer that hospitals have been using for all their clinical forms. We can allow them to use that same tool to build out any form for any department, put it online, and make it intelligent. Put business rules in there so that it looks at different aspects, and then allow the platform to have intelligence in it so that they can do things that they could do with a piece of paper. So think about that purchase requisition form when you were using it. It might have been a 3-ply form that you're putting in an interoffice mailer. Very commonly, you might be attaching additional supporting documentation. You might be attaching RFP responses from vendors you're working with, or contracts, or information about other things you evaluated. FastFlow provides an easy way for an end user to do that, to browsing for files, attaching files, making that even a required step before something can move forward in a process.
In those examples, we just want to highlight, some of the features of the FastFlow workflow platform, so you can go for what's all possible with that solution. So again, it's an enterprise solution. Really, the department that you have a paper process in today that you're looking to automate efficiency around. Is the same form designer that customers are already familiar with. It supports the ability to do things like task scheduling, rules-based workflow, wizard-based workflow creation. We can do multiple applications in the beginning, middle, and end of that process. Avoid any possibility of paper generation. We have services interfaces, so as we're midstream in a workflow, we can perform lookups to add additional information and intelligence to that form as it gets routed. And that we also provide alerts and notifications throughout the process. So as stakeholders within a certain process use their queue, we can generate emails and notifications letting them know that, hey, you've got something that you need to review or approve. May be stuck on the last one. Just go to the bullets a bit. Keep going. Yep, that. High level, just kind of a recap on gap workflow helps hospitals. We really helps hospitals transition many of their paper-based processes to an process. We see an opportunity. Many hospitals have their policies and procedures, but that doesn't mean they're necessarily automated. So, the opportunity to automate the thought or the process that you've already put a lot of thought into, allow you to streamline that and bring it into alignment with that policy. Also, force that policy. Bring your users into compliance, bring your staff into compliance with that policy, and better track how you're doing against that. So we can build a process, but every process has an exception. So the ability to route those documents ad hoc or according to those business rules, eliminate interoffice, intercompany mail altogether, eliminate the possibility of misplaced or lost documents, structured input for how these forms should be completed. Often with paper, you can't control that. You can't control if someone misses a field or important information that someone's going to need further downstream. So we can control that. Providing administration tools to really manage that workflow effectively, and finally eliminate the paper altogether. So in conclusion, today we didn't want your time, but we wanted to share really the argument for why every hospital needs an inter-gap workflow solution in their hospital to address kind of the last mile in many cases where they've made significant improvements to their processes, but still this area that's missing organization. And how organization can we cost effectively address that? Find niche solutions for each of those areas, costly, and it'll take a long time to implement. Or as an organization, we can standardize on one enterprise platform and leverage against those departments, whether clinical or back office, and over time really hospital where it is ultimately on the clinical side, which is a very paperless side. So at this point, we're going. If there's any questions, we'll let Aaron maybe go through some of those questions and we can address them. If not, we'd like to thank everyone for their time in setting in and listening to our webinar today.
Like Pat said, we're going to open it up to questions this time. We're going to get those in, and in the meantime, we're going to have a poll as well. We want to get some feedback from you guys on what processes you'd like to see automated in your hospital. So I'm going to open the poll now. The question is, name the tasks you wish were more automated in your hospital. That's been through a number of different tasks, including physician, rack audits, incident reporting, billing restrictions, staff evaluations, and purchase requests. What other tasks do you wish were more automated? And what we mean by automated is more streamlined, and less paper, if any paper at all. We'll give you just a moment to type in your responses there. You can find the right side of your screen. After doing that, I want to take a quick commercial break and talk about our next webinar in the series. We have a presidential election right around the corner, and there's a lot of speculation about what the outcome will mean for the healthcare community. So the week after the election, we'll be hosting an exclusive webinar with a panel of industry leaders to weigh in on what it might mean for healthcare and how your hospital can prepare. At the end of this session, you'll be presented with a screen so that you can register for that. So don't miss out on that webinar. Okay, we'll keep going with the poll. In the meantime, it looks like we do have a couple questions in. Just so I'd like to know more about Meditech 6.0 and how and where the forms connect in 6.0. Pat or Jordan, can you speak to that?
I can speak to that. There's a number of different integration options with our platform. Across all versions of Meditech, we support the ability to launch into our fast flow application, which is
Yep, we can hear you.
Sorry, I heard a little feedback. We need to integrate with all versions of Meditech through some custom links, which can be created through NPR reports, which can launch into our browser-based products. So, anything with an internet connection has the ability to launch our application. But in 6.0, it also has a feature called URL launch. At almost every screen within 6.0, you can embed custom URLs that call our application in context, which gets to a list of applications, or it can call specific applications depending upon how you can configure that. If there's any, if you need some more information on that, we'd be happy to provide you a demo of how that works.
Which you start in several different tasks. Which one would you recommend starting with?
I think that's a great question, but it comes down to a number of different factors. I would say you could argue that you would some of your easier processes first, is what process are you having the most with today? You know, what's prohibiting revenue, or what's a lot of headaches for staff, or what could make our nurses' lives easier, or our physicians' lives easier? What's the process breaking down? That's the first area of opportunity for the hospital. The other thing is to start in one of the areas is to function that can address that after you feel can address the majority of your needs and implement that in a certain area. A lot of hospitals start with our application in a very specific area that's addressing a very specific problem. But if they can overcome that, then they can build the case for expanding it into other areas. So you exactly where you should start, that's dependent upon the organization, obviously, but the common ones that we run into, you know, there seems to be a big gap in you know, things like purchase requisitions. HR is another big area. Incident report seems to be area of patient finance seem to have a lot of opportunities to enhance or address gap workflow.
And just to kind of, you know, a little bit, one of the strategies that I've been working with my clients as we've been implementing FAO is to really look at different departments and kind of pick a key step process that we want to start in HR, and pick one in HR and one in AP and one in HIM and one in patient finance potentially. And work with those departmental stakeholders just on a specific process in that department. It really doesn't matter which one. The goal is to get everyone educated on what the platform can do and how it can benefit them, because as they implement one, what tends to happen is they see the value, they see the benefit, and they iterate that over and over again.
Looks like we have just one more question, and it has to do with if this is being recorded and if you can get a link. And the answer is yes to both. We are recording, and we'll send you a link to the recording at the end of the session, so you can review that at your leisure. And see if there's any other final questions. And for today, I want to thank Pat and Jordan for your time. If you have questions for either one of them, I'm going to put information up on the screen. You can contact them directly. So it's time to meet with the workflow specialist in the interface you'll see at the end of the webinar. As a reminder, make sure you sign up for the healthcare panel discussion, our next webinar, on the same screen, and that will look something like this. A moment to explore our website. There are a lot of great resources available on there in the resources section, including recordings from previous webinars. Once again, we greatly appreciate your attendance, and we hope you in our next webinar in November.